Infantsee Specialty Eye Care Group Training, Part 1. So this training video is about Infantsee. This is a special program we do in our office. It is a public health program for America's youngest patients, and it is supported by the American Optometric Association. And really what it is that our doctors and our clinic has decided it's a priority to make sure we're seeing kids early and educating their parents. So we donate our time and do free comprehensive eye health and vision assessments for these babies. They are scheduled separately as an Infantsee visit, and it's a one-time, no-cost public health program. We see babies between the ages of 6 months and 1 year. That's what the program's designed for. In our clinic, the sweet spot where we really like to see infants is around 7 to 9 months of age because of their development and how they do in the exam. This is really designed to complement the pediatrician visits. The pediatrician's only able to look at a couple things with vision, and we do a comprehensive assessment. And there's no cost regardless of income or insurance coverage. So we donate our time and do this for free. So one of the main reasons that Infantsee started in about 2005 was there's a lot of children in our country that were just not getting the eye care that they needed, and it's kind of something that parents are not aware of unless they're starting to see a problem, and that is still largely the case. But the reason it is important is children develop their brain pathways, and the most brain pathways are created in the first 3 years of life. Those brain pathways are really critical for the rest of our lives. One thing that's interesting is we actually make 50% of all of our brain connections in our first year, and then by age 2, we've added another 25%. And then after age 3, we only add about 25% more brain connections. So all those brain connections early on serve us for the rest of our life. It's also important to catch vision problems early because our vision develops with our motor, our movement, and really all of our other senses. Meaning, if there's a vision problem, it can definitely cause delay in other things, including things like milestones of sitting, crawling, moving, and even hearing. The need for Infantsee is because undetected vision problems can lead to permanent vision impairment. So the big goal with Infantsee is to be preventative, to see kids early, to catch a problem early or catch a risk factor early so that we can monitor it, and then to be able to treat early. The neat thing about that is if we can do that, we can save lots of money for families and for health insurance, but we can also save a lot of heartache, and we can really enrich lives for many, many years. There is risk, and some of what we're looking for in an Infantsee and in children's exams are an eye turn, or what we call strabismus, and 1 in 25 will develop a strabismus. 1 in 30 young children are at risk of developing amblyopia, which is a delay of vision in one eye or both. 1 in 33 will have a significant refractive error. What that means is that they have too much eye prescription, either nearsighted, farsighted, or astigmatism, which can cause some problem. 1 in 100 will have eye disease, so that could be anything from a cataract to a red eye to a problem in the back of the eye. And 1 in 20,000 will have a retinoblastoma. Now that is a tumor inside the eye, and it is the most common pediatric eye cancer. The reason for all of those reasons, all those risk factors, that's why we do a comprehensive Infantsee assessment. Comprehensive meaning we're looking at, and our doctors are asking about overall development. That's why we ask about some of their milestones and if they're crawling. We measure and look at visual development, how those eyes are learning to see. Kids' vision development is not complete at birth. It is not complete at year 1. It takes years to develop all of the visual skills we need. Refraction is the measuring of their eye prescription, and we do that with a special light and lenses. And then we are also looking at how their eyes track, how they work as a team, and how they focus. And then we're looking at their eye health exam, the front of the eye all the way to the back. These are a couple ways we can do that. On the left, you see a striped paddle. If a baby can see the stripes, they will look at it. That's kind of like a different way of measuring clarity like we do with the eye chart. On the right, the doctor has a retinoscope, and that's how we actually measure their eye prescription before and after the cycloplegic drops. What we're looking for is any difference between the eye or a prescription that's out of range of normal and can cause problems. These are some ways we can look at eye teaming, eye focusing in 3D, and most of it's with toys and lights. The eye health evaluation, you can see a normal retina on the bottom. What the top picture is showing is that retinoblastoma, that tumor, which is that whole white area, and is actually kind of bulging out toward us. But yes, we're looking to make sure that the nerve and the center vision and the blood vessels are all developed normally. We typically do that with our specialized lights and after the dilating drops. A couple things that can help with the appointment. The appointment has two parts. So we see the baby, and typically they just sit on mom or dad's lap and we interact with them. And then that takes about 15 minutes. We put the special cycloplegic drops in. Those take about 45 minutes to do what they need to do. So there's a waiting time in our playroom. It's helpful for parents to know this, that there's two parts, there's 45 minutes in between, so they can figure on about an hour and a half in the office, and that way they can come prepared with diapers, bottles, snacks, or baby's favorite toy. That is all fine and helpful. There is some history we want them to fill out before the visit, and we go ahead and put that into Revolution. When should kids have eye exams? So all babies should take advantage of the Infantsee, the free exam between 6 months and a year, and then kids should be seen every year. The end.